Hello everybody, I am Dr. Hari Prasad, faculty at the Department of Biophysics, All India Institute of Medical Sciences, New Delhi, India. In this particular work, we are trying to understand the usefulness of Apolipoprotein E and α-synuclein as biomarkers that can evaluate pharmacotherapy in these two disease states of Parkinson's disease and schizophrenia. As you all know, dopamine plays an important role in the disease states of Parkinson's disease and schizophrenia. These two neuropsychiatric disorders represent disease endpoints of the dopaminergic spectrum, where Parkinson's disease represents a dopamine deficit state and schizophrenia represents a dopamine hyperactivity in the midbrain. Current treatment strategies aptly therefore aim to restore normal dopamine levels. However, during therapy, there is an overshooting beyond the physiological levels that leads to psychosis in Parkinson's disease and extrapyramidal symptoms in schizophrenia. Currently, there are no available laboratory tests that can assist the patient or the clinician to understand the impending side effects. The objective of this particular study was therefore to evaluate the concentrations of Apolipoprotein E and α-synuclein in the CSF across these two domains, which could give an insight to the plausible prospects of using these two proteins as biomarkers. We therefore recruited patients who were naive and also treated for Parkinson's disease and schizophrenia, and patients who had urological malignancies or bladder cancers were taken as neurological controls. CSF was drawn under sterile conditions and ELISA was carried out to estimate the concentrations of Apolipoprotein E and α-synuclein. Pathway analysis was done to understand the interactions of these two proteins in these two disease states. We found that Apolipoprotein and α-synuclein had concentrations that were inversely proportional to the dopaminergic concentrations in these clinical phenotypes. Each protein by itself or as a combination had the ability to differentiate the pathological state of Parkinson's disease and schizophrenia from physiological state. Pathway analysis clearly establishes the mechanism of co-regulation of these two proteins in these diseases and places this particular results and previously known results in the right perspective. The dynamic variation of these two proteins along the spectrum we feel is an ideal platform for them to be pursued as pharmacotherapeutic biomarkers in CSF to monitor the efficacy in Parkinson's disease and schizophrenia with reasonable accuracy. The outcome of this study will have a translational value and could be used by clinicians and patients to monitor pharmacotherapy in a way that they can make an informed treatment decisions in Parkinson's disease and schizophrenia. Thank you so much for your kind attention.